Can access to heart transplantation be expanded with a new organ preservation technique? Who will be most affected by the rising obesity rates in the U.S.? Will an EHR-based intervention help reduce the use of potentially inappropriate medications in older adults? This and much more on today's JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, January 30th, 2026. I'm Dr. Kirsten Bibbins-Domingo, the editor-in-chief of JAMA and the JAMA Network. Today I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. Let's start with a study on heart transplantation. Heart donation after circulatory death can help address organ shortages. Typically, this method of heart donation requires reanimation, temporarily restarting the donor heart in order to assess the heart function. Dr. Williams and colleagues report a case series examining a new approach which avoids the need for a pre-implant donor heart reanimation. This new process is called rapid recovery with extended ultra-oxygenated preservation, or RE-UP. The investigators describe outcomes of this new process in 24 adult heart transplant recipients at a single U.S. center between November 2024 and July 2025. Primary outcomes were severe primary graft dysfunction, 30-day survival, and early rejection on first endomyocardial biopsy. Only one recipient developed severe primary graft dysfunction, and one recipient had significant acute cellular rejection after transplant. There was a 96% 30-day survival rate, even though many donors were over the age of 40, and many donor hearts had longer preservation times. The authors conclude that this study demonstrated the safety, feasibility, and efficacy of this rapid recovery technique for donation after circulatory death.
High obesity rates in the U.S. contribute to high healthcare costs and a large public health burden, and there's substantial variation in obesity rates across the population. Nicole DeClean and colleagues from the Institute of Health Metrics and Evaluation conducted a cross-sectional analysis using national survey data to estimate current and future U.S. adult obesity prevalence by state, race and ethnicity, sex, and age. The analysis included more than 11 million adults and used data from 1990 to 2022 with projections through 2035. The primary outcome was the prevalence of obesity across these groups. The investigators report that adult obesity in the U.S. rose from 19% in 1990 to 42.5% in 2022, with marked differences by state, race and ethnicity, and sex. By 2035, nearly half of U.S. adults are projected to have obesity, and disparities, especially higher prevalence in Midwestern and Southern states and among non-Hispanic Black females, will likely persist. These results highlight the need to tailor public health policies to address rising obesity rates and persistent disparities across U.S. populations.
About 1 in 5 older adults are prescribed medications that have the potential to increase the risk of falls or hospitalization. These medications include benzodiazepines, sedative hypnotics, and medications with strong anticholinergic effects. Authors from Brigham and Women's Hospital and Harvard Medical School conducted a randomized clinical trial to assess the utility of 2 behavioral science-informed electronic health record (EHR) interventions for deprescribing potentially inappropriate medications in adults aged 65 and older. The 2 interventions focused on either pre-commitment or boostering. The trial included 201 primary care physicians and more than 1,100 older patients who had been prescribed benzodiazepines, sedative hypnotics, or multiple anticholinergic medications. The primary outcome was deprescribing of at least one medication on or after the first patient visit through the end of follow-up. Both EHR interventions led to higher deprescribing rates compared with usual care, with the pre-commitment intervention having the largest effect. These findings support the use of targeted EHR notification for safe prescribing practices and reducing potentially inappropriate medications among older adults.
There's also a new JAMA research letter by Dr. Roy Perlis and colleagues. The appropriate use of artificial intelligence, AI, in scientific publishing is evolving. All authors submitting to JAMA Network journals have been required since August 2023 to disclose any AI use during manuscript preparation. In this cross-sectional study, authors analyzed nearly 106,000 manuscripts submitted to the 13 JAMA network journals between August 2023 and October 2025. They reviewed authors' self-reports to quantify AI use, examined reasons for use, and identified patterns by manuscript type and author country. The investigators report that 3.3% of manuscripts disclose AI use, increasing from 1.7% to nearly 6% over the 27-month study period. AI use for language refinement was the most common reason given, 67.7%, with additional reported use for statistical model development, data analysis, and manuscript drafting. These results highlight the relatively low self-reported AI use and the continuing challenge regarding disclosure accuracy and standards in scientific publishing.
A second research letter from Issam El-Fayyad and colleagues described reported use of AI among research articles submitted to the BMJ journals. The authors performed a cross-sectional study of all research manuscripts submitted from April to November 2024. Among the more than 25,000 eligible submissions, 5.7% reported AI use. Most authors, 87%, reported using AI to improve the quality of writing.
Preeti, you and JAMA deputy editor Dr. Joe Ross wrote an editor's note about these two research letters, and you highlight that artificial intelligence is becoming increasingly integrated into scientific research and manuscript preparation, with these studies in JAMA and BMJ journals showing a growing, but likely underreported, trend of AI use, mainly for language refinement and writing assistance. The editor's note emphasizes the need for ongoing development of clear guidance and standards to ensure transparency and uphold the integrity of research as AI tools continue to evolve and expand in function.
JAMA also published some interesting viewpoints this week. There's a viewpoint from Drs. Chan and Roth about the increasing organ transplant access model from the Centers for Medicare and Medicaid Services. This viewpoint warns that the CMS increasing organ transplant access models focus on increasing transplant volume may undermine long-term patient outcomes and recommends future policies prioritize coordinated accountability and population-level health benefits rather than just transplant volume.
In another viewpoint, Dr. Simon and colleagues proposed that the U.S. Food and Drug Administration establish a publicly accessible Yellow Book database of medical device patents, modeled after the Orange Book for drugs, to improve transparency, research, and oversight around device innovation and market practices. The authors argue that including information on device risk and patent strategies, paired with robust auditing and enforcement, would help regulators, researchers, and the public address competition, safety, and under-examined patent issues in medical devices.
Drs. Young and Koch have a perspective article in which they highlight the ethical and clinical challenges of covert consciousness in behaviorally unresponsive patients undergoing controlled donation after circulatory death. The authors recommend implementing better neurological assessments and clear safeguards to protect donor safety. In another viewpoint, Dr. Williams and colleagues discussed the potential public health implications of the 2025 dietary guidelines. The authors note that the erosion of scientific clarity in the dietary guidelines for Americans may compromise national efforts to improve food environments and public health, and they call on clinicians, health systems, and advocacy organizations to reaffirm the science around nutrition. IgA nephropathy is the most common immune-mediated glomerular disease worldwide, resulting in kidney failure in up to half of adults within a decade. This JAMA review by Dr. Stoneman and colleagues explains that among adults with significant proteinuria, IgA nephropathy should be confirmed by kidney biopsy, and treatment includes behavioral changes, blood pressure control, and targeted therapies to reduce disease progression, as recommended by the 2025 KDIGO guidelines. The accompanying podcast on IgA nephropathy with author Dr. O'Shaughnessy of Galway University and JAMA deputy editor Dr. Kirsten discusses the symptoms, risk factors, diagnosis, treatment, and prognosis of IgA nephropathy in adults.
Speaking of podcasts, listeners are in for a real treat. In the latest JAMA Plus AI Conversations, Dr. Roy Perlis talks to a large language model about the origins of two early chatbots, Eliza and Perry. This episode was created using OpenAI's ChatGPT in voice mode with the GPT-4o web interface. Patients can learn more about adrenal insufficiency with the latest JAMA patient page, which explains the symptoms, diagnosis, and treatment options for this condition caused by inadequate hormone production from the adrenal glands. The article also provides information on how to recognize adrenal crisis, manage the condition during times of stress, and when to seek emergency care.
For the latest developing medical news, subscribe to the JAMA Medical News podcast that publishes every Friday. You can find all the stories from the JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the episode's show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Morrow and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.